Good morning, good afternoon, and good evening to everyone. Thank you for joining us today. It is our great pleasure to welcome you today for this information session focused on the 2021 Annual Enrollment Campaign. We have decided to organize separate information sessions for the UN Worldwide Plan, the UN MIP, and the US-based plans. Today is the second session in a series of 4. This session is dedicated to the UN Worldwide Plan, and this will target all internationally recruited UN staff, retirees, and their eligible family members serving at designated duty stations away from the headquarters. Tomorrow at 9 a.m. New York time, a session will be dedicated to UN MIP participants. The UN Medical Insurance Plan covers locally recruited UN Secretariat staff, retirees, and their eligible family members away from headquarters. And we will repeat the UN MIP session in French next Tuesday at 9 a.m. New York time as well. And yesterday we presented the US-based plans. My name is Julie Boré, Communications Officer at the UN Health and Life Insurance section, and I will be your speaker for today. We will probably only need around about an hour today, so I think that's already good news to start the meeting with or the session with. But I wanted just to allow enough time for questions and answers. Before I proceed with the presentation, I would like to confirm that the recording as well as this presentation will be published on the brand new HLIS website, and that your pre-submitted questions as well as frequently asked questions will be addressed at the end of the presentation. Should you like to review, for instance, a recording on the US-based plans or UNMIP, of course, all recordings will be published on the website. We'll also be happy to answer additional questions, which you can submit through the Q&A box of the webinar tool during the presentation. And as we might not be able to respond to all questions today, the Health and Life Insurance section, the Health and Life Insurance Committee, and third-party administrator Cigna International take note of all questions and will make sure that they are answered after the webinar. The questions and answers will be published on our website by Friday, 25 June. Please find the link to our new website at the bottom of this slide. With that, let's take a look at the agenda for today. Today's session will be dedicated to the 2021 Annual Enrollment Campaign, which is ongoing. Before jumping into the details of the campaign, we trust it is useful to introduce you to the different health insurance partners. You will learn who these partners are and each one's role and responsibilities in allowing us to continue accessing quality healthcare at affordable rates. Afterwards, we'll guide you through the changes effective 1 July 2021, the actions you should take no later than June 30th, and a summary of the coverage levels under the UN Worldwide Plan. In addition, we will provide you with some changes we can all make to avoid financial surprises and steep increases of future premia. The Health and Life Insurance section, in close collaboration with Cigna International, is continuously monitoring solutions available in the health services space that allow us to take control over our own health. We will discuss a key service available to us today. And then we'll conclude today's session with a Q&A, questions and answers, and try to cover as many questions as possible without, of course, exceeding the foreseen time slot. As a first step, let us look at today's participants. So this information session is hosted by the Health and Life Insurance section, together with the Health and Life Insurance Committee. We are committed to respond to every evolving health and life insurance needs, nourished by the feedback that we receive from you, plan participants, as well as from Cigna International. A team of dedicated benefits assistants respond to your questions in a timely and qualitative manner. Last March, the Health and Life Insurance section launched a survey to measure the satisfaction rate of the services provided by HLIS, the Health and Life Insurance section, and by all third-party administrators, including Cigna International. This survey helps us to identify areas for improvement. And while only 15% of the 1,690 participants indicated not to be very pleased with the services provided by HLIS, the accessibility of health and life insurance related information like website and broadcast messages was the main driver for dissatisfaction. We immediately acted upon that feedback. In March, we started the creation of a brand new website that provides comprehensive information on all UNHQ administered health and life insurance plans. And the website was published on June 30th, so very recently. So far, we received feedback that was very enthusiastic feedback and invite you to explore this new platform soonest. The homepage offers you the latest updates from the third-party administrators, HLIS, as well as the events organized by us, HLIS, so the Health and Life Insurance section, and our partner administrators. Throughout this presentation, I will refer you to specific web pages when applicable, as we trust that a new website provides you with everything you need to know on the UNHQ administered health and life insurance plans, including the onboarding process, plan maintenance, and transition after retirement. The Health and Life Insurance Committee is a standing body of the negotiation committee and is comprised of representatives of staff and management, observers from UNDP, UNICEF, and AFIX, the UN medical doctor, our treasurer, and Health and Life Insurance section colleagues. The committee reviews and recommends proposals to insurance eligibility rules, plan changes, and premium rates for the annual renewals of health insurance plans administered by UNHQ, as all our plans are self-funded. The core functions of the Health and Life Insurance Committee include the oversight of the plan benefits, the proposal of insurance eligibility rules and plan design changes, proposal of premium adjustments for the annual renewals, as well as the evaluation of exceptions to insurance eligibility or plan or benefits rules. The colleagues of the UN Health and Life Insurance section and the UN Health and Life Insurance Committee welcome today one third-party administrator, Cigna International, Cigna International Health Services to be complete. Cigna International provides medical and dental insurance to the UN Worldwide Plan participants. Cigna International will closely monitor and answer questions raised in the Q&A box today pertaining to specific coverage questions that you might have. Please just limit your questions to generic questions pertaining to the 2021 annual insurance campaign. Should you have any specific or personal questions, you may, of course, raise them by contacting Cigna directly. And then the main reason for today's session, of course, is you, our staff, retirees, and dependents, mostly participants covered under the UN Worldwide Plan, or interested just in learning what this plan has to offer to participants are joining today's session. As staff members with duty station New York or duty station in the United States, and retirees with a mailing address in New York or the United States again are not allowed under the UN Worldwide Plan, we expect that all attendees will reside outside the United States. Let's have a look at the roles and responsibilities of each partner. The United Nations, in its role of insurer of the self-funded UNHQ administered health plans, the UN Health and Life Insurance section, providing comprehensive health and life insurance plans to eligible staff, retirees, and family members, the plan participants of the UN Worldwide Plan, the knowledgeable consumers of healthcare, and the third-party administrator, Cigna International, who only provides administrative services to us. HLIS conducted more than 20 information sessions in the last 12 months, and we learned that these roles and responsibilities are not widely known within the UN family. It is, however, very important that we have a common understanding of the roles and responsibilities, as it will allow us to better understand the impact of our medical consumption behavior on all of us. Therefore, I will just explain the roles and responsibilities of each of us in the next 2 slides. The United Nations is the policyholder as well as the insurer of the UNHQ administered health insurance plans. In its role of insurer, United Nations offers group insurance plans that cover the risk of a person incurring health-related expenses by spreading the risk across all plan participants. By estimating the overall risk of the group of insured based on the actual plan experience, the Health and Life Insurance Committee recommends a premium which is sufficient to ensure that we, together with the organizations, collect sufficient funds to pay for healthcare benefits specified in the health insurance plans. Throughout the health insurance plans, the UN offers a substitute to a social security system, similar in design and principles to protect us when we risk high health-related expenses. UN headquarters decides on the content of the plans and the plan rules of each health insurance program. In addition, the UN decides on the administrative services the third-party administrators should offer. Claims processing, which might be the core responsibility, is just one out of many services that are offered to safeguard the sustainability of the plan. The next partner is the UN Health and Life Insurance section in the Department of Management, Strategy, Policy and Compliance. All 26 colleagues in our section are committed to provide excellent client services to eligible staff, retirees and their family members enrolled in our health and life insurance program. This responsibility is not limited to the UN Secretariat only. Staff from most agencies, funds and programs are eligible to enroll in one of the plans managed by the Health and Life Insurance section. That is how our health insurance plans protect more than 150,000 individuals today. When staff members are enrolled in a UNHQ administered plan, HLIS transmits the eligibility files to the third-party administrator, which is Cigna International in the case of the UN Worldwide Plan. Changes to insurance plans, including enrollment or termination of eligible dependents during the enrollment campaign or following a qualifying event, will be reflected in these files. HLIS is also responsible for the review of the adequacy of the UNHQ administered health insurance plans. For this exercise, we use actual plan performance details, including evolution of average claims reimbursed and claims cost per plan participant, or at least the average claims cost per plan participant. And we compare the total program cost with the total premiums collected. The cost of healthcare is unfortunately skyrocketing. The last decade, the global annual average medical trend rate reached values close to 10%. The global average medical trend rate is outpacing the average general inflation rate. The medical trend rate is defined as the percentage of change in the cost of healthcare prior to any cost containment measures undertaken by policyholders. As the premiums we pay together with the member states are calculated based on the total amount, the actual amount of medical services consumed during the plan year, our utilization directly impacts the premiums we pay. A plan year runs from July through June. And we continuously look for ways to avoid average annual premium increases similar to the annual average medical trend rate. In the current plan year, so July 2020 through June 2021, the plan year we're still in for the next 14 days, the pandemic has led to a decline in plan utilization during the initial outbreaks and lockdown measures that followed. However, we will all have to contribute to contain costs in the next plan year to avoid steep premium increases in July 2022. I will share some initiatives further down in the presentation. The staff toolkit on the website lists also additional efforts we can all take. When reviewing the adequacy of the plans, we also review the feedback provided by Cigna International and plan participants and verify if benefits and coverage levels are still adequate and meet coverage requirements as stipulated by local authorities. Only then we calculate the impact of suggested plan changes on the premium with, of course, the assistance of Cigna International. Finally, Health and Life Insurance section provides policy and technical support to HR partners. As HR partners are the focal point for staff when changes in family composition like marriage, birth or divorce occur, or changes in a staff member's professional career, including special leave, reappointment or retirement happen, we support HR partners to ensure that the eligibility criteria are well understood, as well as other UNHQ administered plan principles. Most important are, of course, the plan participants, all of us, our fellow our fellow colleagues and us. Our plan is funded by the member states and each of us. The General Assembly has mandated a cost-sharing arrangement where, for the UN Worldwide Plan, 50% of the total cost is borne by staff and retirees, and the other 50% of the cost is paid by the member states. By keeping our medical expenses under control, we contribute to the long-term sustainability of the plan. Besides partially funding our health plan, we can also help keep our plan sustainable by reducing our medical expenses to a minimum. This benefits everyone else under the plan. The lower the total bill, the lower our out-of-pocket expenses will be. And the lower our out-of-pocket expenses, the longer we can benefit from reimbursement before our coverage ceiling is met. And very important in administering our health insurance scheme is the third-party administrator. The UN Worldwide Plan is administered by Cigna International Health Services. This third-party administrator, or as it's known to us as TPA, interprets the plan rules stipulated by UN headquarters. Cigna processes claims for covered benefits that are medically necessary and reasonable and customary expenses. By reasonable and customary, we mean fees and prices that are commonly charged for the treatment or purchase in question, considering, of course, the geographical area where the treatment is given. Furthermore, the treatment or purchase must also be reasonable and customary from a medical point of view. This means, for example, that the number of tests, dosage of medication, etc., should be medically justified. In addition, Cigna responds to inquiries from plan members. These inquiries include benefit questions, reimbursement questions, and pre-certifications. To allow access to care to us, Cigna issues personal ID cards to all individuals covered under the plan and offers a broad network or a broad selection of in-network providers that allows to access quality healthcare at preferential rates. While our plans allow both in-network and out-of-network treatments, we really want to encourage you to visit in-network providers when possible. I'm sure we all understand that this is not only crucial to ensure the financial sustainability of our plan, it also improves our health experience. Now, what will change effective 1 July 2021? There will be no premium changes for the UN Worldwide Plan effective 1 July 2021. The UN Worldwide Plan will cover telephone and video consultations with in-network and out-of-network service providers. This enhancement was already introduced at the outbreak of the COVID-19 pandemic early April 2020. However, it will be embedded in the plan design now as a new benefit effective 1 July. As we prepare for the new normal, we can hardly imagine a medical world without the possibility to consult a doctor from the comfort of our homes. I would like to remind you, though, that these consultations will not yield any financial benefits to our plan. Cigna still offers telehealth, Cigna Global Telehealth consultations through, again, Cigna Global Telehealth is the name of the product. This service is cheaper. It even comes at no additional cost to the members, so you will avoid costs on the plan should you use this service instead. And I will talk about Cigna Global Telehealth as well later on this presentation. In addition, we will introduce smoking cessation coverage in the next plan year. This benefit will cover sessions with a tobacologist and or addiction therapist under the psychotherapy benefits of 80% plus the major medical benefits plan. The treatment must be provided by a doctor or licensed psychologist with experience on addiction and or smoking cessation. There's an important preventive aspect, of course, to these benefits in the sense that quitting smoking improves overall health and prevents serious illness. I think that is very, very clear and obvious. Then I would like to quickly guide you through one of the latest service updates from Cigna International. In April 2021, so about 2 months ago, Skype calling to Cigna customer services is made available on the UN Worldwide plan, making it easier for you to get in touch with Cigna. If you already used Skype, simply add Cigna Health Benefits to your contact list. If you are new to Skype, download the Skype app, create a Skype account or login with your existing Microsoft accounts. Search for Cigna Health Benefits and add Cigna Health Benefits to your contact list. And click on the name and a Skype call will, with the Cigna contact person will start. A Cigna contact or Cigna representative in the Cigna contact center. When you call Cigna, Cigna will need your full name and date of birth, and also please make sure you have your personal reference number with you as well. But this is of course similar to regular phone calls. Not all local telephone providers support toll-free lines, unfortunately, but calling Cigna using Skype gives you the peace of mind that your call is completely free of charge, no matter where you are in the world. And I think that is a very important benefit, of course, in a global plan. You can also use Cigna's personal or your personal web pages or the Cigna Health Benefits application to request a call back from a member of Cigna's customer service team. So these are 2 additional communication methods that are added to the for the UN Worldwide Plan participants. I will also list all the contact channels at the end of these presentations, at the end of this presentation again. Then let's look at some key principles of the UN Worldwide Plan. This is, of course, a summary. So if you need further guidance, there is a benefits booklet on our website as well as on the Cigna web pages. Some information or summary is also provided in our information circular. And of course, you can always contact Cigna's contact center or write an email to Cigna for any additional questions you might have on the coverage. The aim. The UN Worldwide Plan covers reasonable and customary expenses, as mentioned before, and medically necessary expenses for medical, dental, and hospital treatments resulting from sickness, accident, or maternity. The annual maximum is $250,000 per person per calendar year. So each individual under the plan has an annual maximum of $250,000 from 1 January through 31 December. No matter where you are in the world, no matter where your duty station is located. Area of cover. You have access to worldwide coverage. So the UN Worldwide Plan provides worldwide coverage with, and very important, with strict limitations for care in the United States of America. And I think, and I will also further elaborate on that during the presentation, but please keep in mind that whenever you need care in the US, you're planning to seek care in the US in the next year with the duty station outside the US, even with the duty station outside the US, that you should strongly consider to change to a US-based plan now. And I will also give you some examples why we really want to advise you there to also protect you, not just the plan, but also to protect you as a plan participant. Claim submission deadline is 2 years, so 24 months between the date on which the expenses were incurred and the date of receipt by Cigna, of the claim received by Cigna. So 24 months should of course be sufficient, especially because all of you have access to online claiming. So basically you can just go and see a doctor and snap a picture directly through the Cigna Health Benefits application and then send it to Cigna right away. So there shouldn't be any further delay there. The prior approval requirements, so prior approval from Cigna's medical board is required for all non-emergency hospitalization. So please keep that in mind if you have a planned treatment coming up, planned hospitalization coming up, or day hospitalization as well, including day hospitalization. Write to Cigna as soon as possible to receive a prior approval, as well as a copy of the guarantee of payment that will be sent to the hospital for that, to cover that specific treatment. Then general coverage details. This might be a little bit overwhelming, but there are quite some good examples as well in the benefits booklet. But basically, the UN Worldwide Plan provides 2 levels of coverage. First one is the basic medical insurance plan, also called BMIP, and the second one is the major medical benefits plan, the MMBP. The MMBP, so the major medical benefits plan, covers 80% of the difference between the accepted cost and the amount reimbursed under the basic medical insurance plan. In order to be entitled to any reimbursement under the MMBP, a calendar year maximum co-payment of $200 per plan member or $600 per family should be reached. To give you a very simple example there, so this is on a calendar year basis, right? So if, for instance, your total out-of-pockets equal $200 by February already, because many expenses or many benefits are covered at 80%. So once you reach a total out-of-pocket maximum of $200, the plan will not just reimburse 80%, but will reimburse an additional 80% on the 80% patient share. So for instance, you go to a doctor, your doctor bill is $10, you are reimbursed $8, and $2 is the patient share. All these patient shares or co-payments, when you add them up and you reach $200, and you go again to a doctor and the doctor bill is still $10, you will receive a reimbursement of $9.6 instead of $8. I hope this is clear, but again, there are quite some good examples as well in the benefits booklet. Important, one of the first warnings, the major medical benefits plan will not kick in the US, for care in the US, meaning that if you're, as a UN Worldwide Plan member, go to the US for care, you will only receive a reimbursement of 80%. The cost of medical care in the US is extremely high compared to the rest of the world. So 20% patient share will still be a very high portion to pay for. So that is the first warning, but I will share some additional warnings there as well to give you a good understanding on the risk of being covered under the UN Worldwide Plan and seeking care in the US. Inpatient care benefits, again, very high level, but bed and wards is covered at 100% for semi-private rooms and wards. So private rooms are not covered at 100%. This should be very well understood. Coverage of 100% only applies to semi-private rooms and wards. Definitions of wards and semi-private rooms are also explained in the plan documents. As well as in the information circular, we made sure that it was explained this year. So please keep that in mind. What is the ceiling per day? That depends on your location. That depends not on your location of duty station, that depends on the country of care where you are treated. If you go to the benefits booklet of Cigna, you will see all the different ceilings per day per country. So, of course, when Cigna has in-network providers, they will try to negotiate up to the ceiling, of course, that is foreseen. But I just wanted to make sure that it is well understood as well. Could be, or it will be, that the ceiling, for instance, in Switzerland for the daily ceiling for hospitalization will be different compared to, let's use India as an example. Stay in the ICU is covered at 100%. Other hospital expenses, thinking of MRIs, for instance, covered at 100%. Doctor fees are covered at 80%, again with that major medical benefits component. So once $200 individual or $600 per family is reached, maximum, then the plan will reimburse 96% instead of 80%. Personal expenses are not covered. Again, I think the medical necessity was discussed a couple of times already. It is a medical plan, and the spirit of a medical plan implies that there is no coverage of, let's just use an example, of telephone costs you may incur while being hospitalized, or an additional meal for an accompanying partner, for instance. Outpatient care. You will see here at the left-hand side the coverage, and then on the right-hand side the ceiling. So you will see one ceiling in yellow, and I will explain why I highlighted that specific ceiling. Dental care is covered at 80% with a maximum of $1,000 per person per calendar year, and there's 1 year carryover. So if you did not exhaust your annual ceiling this year, for instance in 2021, then and you need more expensive care in 2022, then the portion that was not used in 2021 can also be used in 2022. That's only for 1 year that the carryover applies. Optical glasses and frames covered at 80%, $250 maximum for 24 months. Physiotherapy, 80% plus major medical benefits plan. Prior approval is required as of the 61st session per calendar year. Psychotherapy, 80% plus MMBP. Today, currently, and I just really want to be very clear there, we're still in the plan year 2020 to 2021. Prior approval is still required as of the 11th session per calendar year. What will change on the 1st of July? Prior approval by Cigna's medical board will only be required as of the 31st session. Please note that, of course, doctors' prescriptions will still be required as of the 1st session. It is just a prior approval requirement that is no longer needed as of the 11th, but will only be required as of the 31st session to, again, improve the access to also mental health care, especially also during these times. Preventive care is covered at 100% with a annual maximum of $1,050 per person per year. Ceilings are always per calendar year, so our plan years go from July through June, meaning that you can now, of course, enroll for the next plan year, meaning that you will be covered under the UN-Worldwide plan from 1 July through 30 June. The ceilings are always set on a calendar year from 1 January through 31 December. Care in the US. The UN-Worldwide plan does not provide adequate cover in the US. It does provide cover in the US, meaning that if you have any expenses incurred in the US, Cigna will accept your claim and will process it according to the plan benefits that we stipulated. However, it does not provide adequate coverage in the US. Therefore, staff members and retirees who plan to seek care in the US in the next plan year, of course, with retirees, the enrollment campaign is not open, but I will also talk about that later on. I think it was raised in one of the FAQs, the frequently asked questions. But staff members and retirees who plan to seek care in the US in the next plan year are strongly encouraged to enroll in one of the US-based plans. You are all eligible, all UN-Worldwide plan members are also eligible to enroll in one of the US-based plans. Aetna and Empire are the two medical plans, or Aetna and Empire PPO are the two medical plans. And for dental care, we have a plan called Cigna Dental PPO which is of course very different from the UN Worldwide Plan. It's just both administered by Cigna in the US. So please really take that consideration. Should your home country be the United States? Should you have family members in the United States? Or any other reason why you think you might need to seek care in the US in the next plan year, consider changing plans. Why? First of all, the annual limit of $250,000 under the UN Worldwide Plan is insufficient in the US, especially in case of complications. I'm not saying that it will be insufficient for everyone, but of course, if you're going to a surgery, whatever kind of complication might occur, $250 maximum is easily reached in the US. So that is a first reason why you should change to a US-based plan. Then secondly, the major medical component, so the major medical benefits plan, does not kick in for care rendered in the US. I already explained that before. The 20% patient share will still be applicable for everyone who is seeking care in the United States, and 20% out of a huge invoice is still a huge amount of money, right? Then thirdly, there's a $5,000 annual deductible per plan participant that is applied in the US, and $15,000 per family. So the plan will even not start reimbursing any expenses, especially not for non-emergency care, a planned visit, a planned surgery, before the $5,000 deductible is reached. And then a fourth reason, the UN Worldwide Plan premiums are just not sufficient to cover the high cost of healthcare in the United States. That is, of course, why we have separate plans. Premiums paid under the UN Worldwide Plan are much lower than the premiums that are paid under the US-based plans for that same reason. So again, our consumption behavior does impact the future premiums, and that's also why care in the US cannot be, like reimbursed at the same coverage levels as worldwide care. The next slide, I would like to talk to you about Cigna Global Telehealth. That is the one service I really wanted to highlight. Luckily, we've seen many people finding their way in the last year to global telehealth. The reason for that is, of course, not that great, but of course, with limited access to care, with reasons why, the comfort of your homes was even more important than before. Many more people, plan participants, are using Cigna Global Telehealth, but also in the US, we've seen an uptake in that service, or the utilization of that service. There are times just when you need to speak to a doctor, but sometimes arranging a visit is difficult to manage, and therefore we made it possible to all UN Worldwide Plan members to have a convenient access to quality healthcare through Cigna Global Telehealth, a service available through the Cigna Wellbeing application. I already talked about the Cigna Health Benefits application, which will give you all the tools to follow up on claims, to look for your personal ID cards, to look for an in-network provider. There's also the Cigna Wellbeing application for management of health and well-being, and there you can access care through the Cigna Global Telehealth service. Global Telehealth gives you access to licensed doctors around the world for non-emergency health issues. Simply arrange a telephone or video consultation from Cigna's Wellbeing application, and appointments are often scheduled for the same day. All Cigna's customer representatives in the contact centers are well trained on the service. So should you have any issues with accessing the application, or should you require some guidance, you can of course still reach out to Cigna, the same contact numbers as you have for medical care or in-person care through the plan, and the service representatives will be happy to help you there. Oh, sorry. What can we use Cigna Telehealth for? When we need just to speak to a licensed doctor, we can arrange a video or phone consultation. We can request prescriptions when medically necessary. We can also use a service for a diagnosis for non-emergency health. issues and acute conditions, to prepare for an upcoming consultation or hospitalization, and even to discuss a medication or treatment plan and potential side effects. Why is global telehealth such a valuable service? Yeah, again, it is first of all free of charge. There's no additional out-of-pocket expenses. It's an alternative to a doctor office or a clinic visit with no patient portion. So the cost is the first reason. Secondly, it is easy. There's no need to leave the house or your workplace. Thirdly, it is accessible around the clock. And fourthly, it is flexible. You have mobile application to real-time scheduling, so you can easily set up an appointment at any time that works for you. Also very important, of course, for a global workforce, it is a multilingual environment. Currently, video consultations are available in English and Spanish, while telephonic consultations are available in English, Spanish, French, German, Portuguese, Chinese, Japanese, Hindi, and Arabic. How does it work? We download and use the Cigna Wellbeing application to make an appointment with a doctor or specialist. And this application is different from the Cigna Health Benefits application and can be found in the Apple Store and on Google Play. More information about this benefit is available on the website, on our website, as well as Cigna's website. And we strongly encourage all UN-Worldwide plan members to start using this service to discover the benefits Cigna Global Telehealth has to offer. Now, coming back to the annual enrollment campaign, what actions should you take no later than the 30th of June? The annual enrollment campaign is the only opportunity to make changes, to your health insurance plan. The system will automatically end the campaign period on the date and all changes on that date, on the 30th of June, and all changes will be effective 1 July 2021. After 30 June, no further actions can be completed without a qualifying work or live event. That being said, please review your current health insurance coverage in your organization's ERP system, which you will find on the slides, UMOJA for UN Secretariat, and then SAP, HLIS, and OneUNOPS for our partner organizations. What should be reviewed? Are you enrolled in a plan? In which plan are you enrolled? Are eligible family members enrolled as well? Read about the UN-Worldwide plan on the HLIS website, or contact Cigna International through the dedicated channel should you have specific coverage questions. Of course, if you again plan to seek care in the next plan year and you would like to get more information on the US-based plans, you will also find details on these plans on our website. And today we will also publish the dedicated contact details for Aetna, Empire, and Cigna Dental on our website, where even non-plan participants can contact the third-party administrators. If desired, or first of all, what you can also do is to simulate the rates. So you can estimate the future premium through the insurance rate simulator on the HLIS website to get a good idea of the continuation under the plan, as well as the organization's subsidy. This is, of course, was made possible with the kind help of our UNDP colleagues who designed the insurance rate simulator. And if desired, you can make a change to your health insurance plan by 30 June 2021. For UN Secretariat, this will happen in UMOJA ESS, so the UMOJA employee self-service. Can I please just remind you to print a confirmation in ESS when the changes are made. This confirmation is sufficient and you should not seek further confirmation with our HLIS colleagues. You will understand that the inflow of emails in the HLIS mailboxes is exceptionally high during this time of the year, and therefore we kindly ask you just to not to contact our team anymore for any confirmations, but just print the confirmation, proof of confirmation in Umoja, which is definitely legitimate. You will find instructions, if needed, on how to print the confirmation on our website on the annual enrollment campaign page, where you will find job aids to make changes in Umoja. The annual enrollment page of our website, again, guides you through all kinds of changes, so please have a look there. And staff members from other organizations will need to complete the annual enrollment form, which is also on our website. You can do this electronically or submit the same to your organization. All forms are made editable on the new website, so I think that this definitely also increases the user experience. What changes can you make in June? So there are 3 changes you can make in June. Again, it's the only opportunity until the next annual enrollment campaign in June 2022 to enroll or terminate in the United Nations headquarters administered health insurance program, make changes to another plan, again, from, for instance, your worldwide plan to the US-based plans, should you plan to seek care in the next plan year in the US, or add or terminate coverage for eligible dependents, aside again from the specific qualifying events such as marriage, divorce, death, birth or adoption of a child, or transfer within the United Nations system, for which special provisions for enrollment between annual enrollment campaigns are established. Our information circular provides information on the qualifying events for enrollments and termination outside the annual enrollment campaign period. And while enrollment is voluntary, we advise staff to seriously consider enrollment in the UN Worldwide Plan, as it offers rich benefits. And the plan is for 50% funded by the member states. I just added these two findings or observations again to the slides, because should we have any staff members with headquarters with a duty station in New York on the call, please know that there's no option for you to change to a UN Worldwide Plan. So when your duty station is New York, or your duty station is in the United States, or you're a retiree with a mailing address in the United States, you do not have the option to enroll in the UN Worldwide Plan. The opposite, as explained before, is obviously possible. If you're if you have a duty station outside the United States and you're planning to seek care in the US, of course, you're very welcome also on the US-based plans. Before we move to the annual enrollments campaign contact details and Q&A, I would like to just summarize once again some important ways to avoid surprises and steep increases of future premia. Whereas the last plan year was heavily impacted by the COVID-19 pandemic, and we noticed a decrease in plan utilization at the outbreak, as less participants sought care, we cannot expect this underutilization to continue. While the impact of deferred treatments and long-term healthcare is still unknown, the general expectation is that plan participants will return to normal levels during 2021, and the global average medical trend rate for 2021 is expected to reach a level of 7.2% again, with poor stress management being a top 3 risk factor driving future adverse medical costs. It is a common responsibility of plan participants of the self-funded UNHQ administered health insurance plans to safeguard the sustainability of these plans and enjoy minimum premium changes in the coming plan years. How can you do that? UN Worldwide Plan members might make use of subsidized medical care and or might claim expenses with a primary insurance first. When surgery is prescribed, a second medical opinion is advisable. This service can be accessed free of charge through Cigna Global Telehealth. And finally, in case of planned surgery and daycare, members should obtain a cost estimate and share this with Cigna, for review and facilitation of direct payments. The first one I did not repeat again, but of course, replacing in-person consultations with telehealth consultations, except for all the other benefits just on you as a plan participant. There's also a financial impact on the plan, a positive financial impact, because these consultations do not come at any additional cost. Then one slide just on the provider portal, as I truly hope that all plan participants know of its existence. If not, I think this can be a very good reminder. So we always emphasize on trying to look for in-network care, right? Trying to access in-network care where possible. Again, for the user experience, direct billing might be set up, price lists have been negotiated, etc. Where can you find for look for in-network providers? You can look for the country, you can look for the city. Not only in your duty station, but for instance, if you're traveling to your home country, or you're traveling personal travel or duty travel, you can also look, of course, for a location and then see what providers are in the network. You can look for the type of provider, a hospital, a doctor, dentist. Dentists are not very often in the network, but for instance, a pharmacy, and then choose a specialty, a medical specialty. Then you will find the overview here. This is an example for Vienna, Austria, where you will find a list of all the in-network providers. So it shows that Cigna has 32 in-network providers in Vienna. The first column, and the legend is at the right-hand side, means that Cigna has direct payment agreement for inpatient care. Inpatient care means that there's at least one overnight stay at a hospital. Secondly, direct payment to the provider, to provider of outpatient care. So outpatient care is, for instance, a scan outpatient, so that is when there's no hospitalization and there's no admission at the hospital. And then thirdly, it will indicate whether there were any price agreements, so preferential rates for Cigna members, or basically UN-Worldwide plan members. I hope this is clear. Of course, there's also a map, so I think that's also very useful. And again, this is accessible through the Cigna web pages, as well as through the Cigna Health Benefits application. So even if you're in the city and you need to look for an in-network provider, you can do that through the mobile application as well. Now, that brings us to the last slide of this presentation before we go to the Q&A. What to do next if you have any additional questions related to the plan design, eligibility criteria, changes in Umoja ESS, or should you like to attend another information session, you can visit our brand new website and find everything you should know about our UNHQ administered health insurance plans. Should you have any questions related to the benefits coverage, call the dedicated phone number on the back of the Cigna ID cards, or of course use any of the other means to reach out to Cigna. Where on this slide you will also see that a commercial Skype and a callback feature are added to the more traditional ways to contact Cigna that were already available to you prior to April 2021. And then, of course, do you still have questions? Our HLIS team is ready to help you, and we invite you to complete the Contact Us form on the website, should you like to contact us. So you will see that our new website has a Contact Us form where some information is already required, your name and index number, your organization, which will facilitate our benefit or make it easier for our benefits assistants to identify you, and to which then again guarantees a swifter turnaround time. And that brings me to the end of the presentation. We still have time to cover some of your questions now, and we'll make sure to provide you with answers to all the questions after this session. We will publish the Q&A document on our website by Friday, 25 June, which is next week, Friday. My colleagues Valentina Bono and Wesley Carlesor are kind enough to guide me through the questions, the pre-submitted questions and frequently asked questions, while other HLIS colleagues and our focal points in Cigna International, of course, will continue to respond to questions you raise in the Q&A box. And I will just show you the Q&A slide, and then you will see also a picture of our new website. Sorry. Valentina and Wesley, can I count on you to raise any questions you have seen?
Good morning, Julie. Good morning and good afternoon, colleagues. So welcome to the Q&A session on UN Worldwide Plan. And Julie, I will start with the first question.
Yeah.
My duty station is not in New York. Can I enroll in a US-based plan?
Yeah, so indeed, I try to cover it, but I think it's indeed one of the questions that we receive quite often throughout the year. Yes, you have to change now. Staff members and retirees who are considering coverage for themselves or for family members, of course, and residing in the United States, and not for themselves because then you're not allowed, but for family members residing in the United States of America, or who intends to seek medical care in the United States on a regular basis, are reminded that they should consider enrolling in the United States based plan during the annual enrollment campaign in June. So again, if your duty station is outside New York, and you're planning to seek care, please enroll now in a US based plan for the next plan year.
Thank you, Julie.
Thank you, Julie. This topic is one that you spent an extensive amount of time on, but I'm going to reiterate. What changes can staff members make during the annual enrollment campaign?
Yeah, three changes that can be made. First of all, you can enroll or terminate enrollment in the United Nations headquarters administered health insurance scheme. Secondly, you can change to another plan, for instance, from UN Worldwide Plan to a US-based plan. And you can add or terminate coverage for eligible dependents outside of the work or life, qualifying work or life events. Thank you, Wesley.
Hello, Julie. Next question is, where can I look for in-network providers?
Yeah, so I did include a slide there, and I hope it was quite clear, but so there are two platforms that will allow you to look for in-network providers. The first one is the Cigna Health Benefits pages, which are your member pages. It's cignahealthbenefits.com, and then you will have to log in with your Cigna reference number starting by 001. And a password, and there you have the provider search functionality, or you go to the Cigna Health Benefits application, and there is the option to look for in-network providers on the application as well. Thank you.
Thank you, Julie.
And Julie, here's a question from the retirees. Is the annual enrollment campaign open to retirees as well?
Yeah, no, retirees enroll in the after-service health insurance program who change their country of primary residence following separation may also transfer from one insurance plan to another if a different plan is more appropriate to the new country of residence. That is at time of retirement. So the annual enrollment campaign is not open to retirees. There are options to change plans, but it's not the annual enrollment campaign. With respect to the health insurance plans available to after-service health insurance participants who reside in the United States, transfers from one plan to another may be made subject to the condition that there must be at least 2 years coverage under any such plan before a change can be made. For instance, you're now in a UN Worldwide Plan, you're retiring at the end of this month. On 1 July or upon retirement, you will be able to change, for instance, to a US-based plan should you have plans to move to the US. As of that moment, you have 2 years that you have to be enrolled in either Aetna or Empire, the plan you chose upon retirement, and only when you were covered at least for a period of 2 years, which is not related to the annual enrollment campaign again, then you can change to another US-based plan should you wish to do so. I hope this answers the question, Wesley.
Thank you, Julie. It's very clear to me. So how much will a Cigna Global Telehealth consultation cost?
Yeah, so Cigna Global Telehealth is at no additional cost or at no additional out-of-pocket cost to UN-Worldwide plan members. So while you will not pay an additional cost, the advantages, again, of consulting a doctor through the telehealth service are numerous. There's no, just to list some, there's no commute time, of course, to be spent. You call from the comforts of your home, which is, of course, when you're sick or you have specific symptoms, can be very reassuring. You talk to specialized doctors who might speak your mother tongue. And also, and that's from also personal experience through the different telehealth services available to for the different plans. Overall, the telehealth doctors take more time than an average doctor does for in-person consultations. So you really have the time to ask questions related to symptoms, related to an ongoing illness, or to, for instance, prepare for an upcoming surgery, or you would like to seek a second medical opinion for a suggested treatment. Thank you, Valentina.
Julie, when can I expect my new ID card? Should I decide to enroll in a new health insurance plan effective 1st of July 2021?
Yeah. So the new cards will not, of course, be immediately available. The electronic ID cards for Cigna will be available very shortly, but from a time frame perspective, so cards are, of course, shipped by the third-party administrators to the subscribers' mailing addresses for UN-Worldwide plan, as well as for the US-based plans. On average, 10 business days after the upload of the insurance eligibility file, which is transmitted to the insurance carriers at the start of the month. So, but you should really allow 1 to 2 months upon enrollment to receive your plastic card. For UN-Worldwide plan members, very important to know that as soon as your eligibility information is transmitted to the carrier, to Cigna International, and they upload the eligibility file, at the moment that the eligibility file is uploaded, an automated a welcome email will be sent to all plan participants with the reference number, and then there's an activation email that will follow. All plan participants will have access to electronic ID cards as of that moment. And I think that is very important, of course. So that does not mean that you have to wait for the plastic ID card. You will already have your electronic ID card available, which is also, again, accessible through the Cigna Health Benefits application. So even on your mobile phone, if you have the application downloaded, and of course, if not done yet, please do so, the Cigna Health Benefits application, and then you have your ID card with you at all times. Thank you.
Thank you, Julie. When will my new coverage go into effect?
As soon as 1 July 2021. So if you're not yet enrolled in the UN-Worldwide plan, or you're changing from a US-based plan to the UN-Worldwide plan, or the other way around, even the changes you will make on 30 June will be reflected on the next eligibility file with a coverage start date 1 July 2021.
Thank you, Julie.
Will my newborn baby be covered?
Will a newborn baby be covered? It will depend on you, right? So yes, provided again that you enroll your newborn in your health insurance plan within 31 days after birth. And that goes with all qualifying events. The qualifying events are clearly listed in the information circular and on our website. And you just have to take action with whatever qualifying event, whether it's a live event or a work event, within 31 days after the event. In this case, in the case of a newborn baby, of course, a qualifying event is the birth. So I hope that is clear. So please make sure that you enroll your newborn baby within the 31 days following the birth. Thank you, Wesley.
Thank you, Julie. Now we have a question that is very common, especially lately. Which family members are eligible to enroll in my health insurance plan?
Yeah. So eligible family members, also very clearly defined in our STIC, the information circular, do not include secondary dependents, family members of temporary staff members with appointments of less than 3 months, or family members of occasional workers. These are the three types of members or occasions when eligibility criteria do not apply. Secondary dependents. What do we mean by secondary dependents? Parents, siblings, grandparents, grandchildren. So everyone. I'm sorry, that is not the recognized spouse or the dependent children. The term eligible family members refers to one recognized spouse and one or more dependent children. The United Nations Health Insurance Program recognizes only one eligible spouse for coverage. A dependent child is one who meets the definition according to the staff rules and is a household member in the, again, UMOJA system for UN Secretariat staff, HLIS system for UNDP, the SAP system for UNICEF, or the One UNOP system for UNOPS. A child is eligible to enroll or to be covered under the program until the end of the calendar year in which he or she attains the age of 25. So should you have a child that turns 25 today on the 16th of June 2021, coverage will only cease on the 31st of December 2021. It will automatically cease. It will cease. So you just have to be very much aware of the fact that indeed your child will no longer be eligible for coverage after 31 December 2021 in this concrete example. Children with disabilities, however, may be eligible for continued coverage beyond the beyond the age of 25. If they are certified with a disability by the Division of Healthcare Management and Occupational Safety and Health, so our DMOSH colleagues. If the parent is an active staff member, and in the case of a retiree, when the parent is a retiree, if the certification is given by the United Nations Joint Pension Funds. Thank you.
And does the UN Worldwide Plan provide coverage for maternity care, also called maternity assistance?
Yeah, yes, maternity care is covered at 80% and is reimbursable until 8 days after delivery. Each day in a hospital has to be deducted though. So for instance, a patient stays in a hospital for 5 days. She can have 3 days of maternity care at home. The plan pays up to the maximum of 7 hours per day. And in case of home delivery, midwife fees and material care and materials, are also covered at 80%.
Thank you, Julie. The next question is about fraud and is how can I help fighting fraud, waste and abuse?
Yeah, so you are of course strongly encouraged to review your explanation of benefits or settlement notes or claim statements. It's all the same, of course, to ensure that only services that are rendered from the provider are billed. This is really your responsibility. So whenever a claim is reimbursed, you will have a settlement note available to you, again, through the Cigna Health Benefits application or online on the web pages. And you should verify indeed if all the care was provided. Furthermore, it is also the responsibilities of the plan participants to report any questionable charges to the third-party administrators so they can be investigated. Fraud, waste and abuse investigation is one of the services that we request from third-party administrators to perform. Why? Again, to safeguard the viability of the plan, but also to ensure that you, our colleagues, our children still have easy access to quality care without any providers being suspended, without any risks that come with fraud, waste, and abuse. So I hope this answers the question, Valentina.
Yes, thank you, Julie.
Hi, Julie. This is a question about coordination of benefits. How are benefits coordinated if I'm covered by 2 or more plans?
Yeah, so I already indicated that having, for instance, a primary insurance or a government-sponsored security system is definitely one of the ways where, of course, the cost on the plan will be reduced. Now, how will that happen? The United Nations Health Insurance Program does not reimburse the cost of services that have been covered already by another insurance company, social security system, or a similar arrangement. For those participants covered by 2 or more plans, the United Nations Health Insurance Program coordinates benefits to ensure that the participant receives, of course, as much coverage as possible, but not in excess of expenses incurred. So plan participants covered under the United Nations Health Insurance Plan are expected to advise a third-party administrator, here Cigna International, when a claim can also be made against another insurer. I think that is. I hope it's complete.
Yes, I think so. Thank you, Julie. The next question is, can I make changes to my insurance coverage between annual enrollment campaigns?
Yeah, so depends. Only if at least one of the qualifying events occur and enrollment is completed again within 31 days of such occurrence. Appointment or reappointment, transfer or assignment to a new duty station. New duty station is important here. Marriage or divorce of a staff member, marriage or full-time employment of a covered child, very important. I just want to elaborate a little bit further on that. Whereas I said enrollments or eligible children can be enrolled until the end of until the age of 25, provided that they're not married or full-time employed. This is a very important one. So once your child below 25 is getting married or full-time employed, we need to be aware of this, and we will have to terminate insurance coverage within the 31 days. Should this not happen, and afterwards we will have to recollect all the reimbursements that were made for care towards your child. So really take action. It is your responsibility again as a staff member to also know these rules, staff member or retiree, of course, and make sure that we are notified as soon as your child below the age of 25 gets married or full-time employed. Then birth, legal adoption, or death. And yeah, the presentation of proof of loss of employment and loss of coverage by the staff member under a spouse's health insurance plan is also a qualifying event, with the loss of employment being the qualifying event. So once your spouse loses employment and it's due to a layoff, for instance, when it's not own choice, then within 31 days of such termination of employment, we need to be notified should you like to be enrolled in the in the United Nations headquarters administered health insurance program. You can also find the list of the qualifying events again in the information circular should you like to read a review, or should you just should you like to get a summary again from of these qualifying events. Thank you, Valentina.
Thank you, Julie.
Life insurance. Can we also apply for life insurance during the annual enrollment campaign?
So you can definitely. The annual enrollment campaign is not related to life insurance, but you can. So there are two ways to enroll in the UN life insurance plan. There's an unconditional enrollment and a conditional enrollment. Unconditional enrollment means that staff members will have 60 days from the date of employment to enroll in the life insurance plan without providing any additional documentation. So of course, it's not automatic. You still have to inform our health and life insurance colleagues that you are planning to enroll in such program. Conditional enrollment means that you have, for instance, missed the 60 days or there's any other reason why you would like to enroll in life insurance and you did not do that upon appointment. Then enrollment becomes conditional, which means that the staff member will have to submit the Hartford's evidence of insurability form. The Hartford is the insurance company providing life insurance to us. To HLIS for a first review, and after which HLIS will forward the form to the Hartford, which will evaluate again if anything else is provided, is needed, I'm sorry. For instance, further additional medical examination at the applicant's own expense. But so it could also be denied. So that's also why it is conditional after the 60 days following the appointment. Thank you, Wesley.
Thank you, Julie. The next question is, can you please remind me of the restrictions under UN Worldwide Plan for Care in the US? Thank you.
Yeah, I think it was I tackled it quite elaborately, but again, this is also one of the questions that we often receive. So the deductible of $5,000 per insured person and $15,000 per family per calendar year has to be met before any reimbursements are made under the program. Very important, right? It's a huge amount of money, and this is just already an amount that needs to be paid before the plan starts to reimburse any expenses in the United States. The program will reimburse then afterwards 80% of all medically necessary treatments under the medical insurance plan, the basic medical insurance plan, that is, and a participant will pay the 20% residual cost after the deductible is met. Always, there is no major medical component that kicks in for planned care. Thank you, Valentina.
Thank you, Julie.
Julie, what actions do I need to take upon return to work following special leave without pay?
Yeah, okay. So after special leave without pay, and that is one of the changes we made in the information circular as of July. When you return to duty following a special leave without pay, UMOJA automatically reinstates coverage for United Nations staff members under the health insurance plan and coverage type in which you were insured before the special leave without pay. Why did we make that enhancement? Because some staff did forget to re-enroll in the plan. And then, of course, you're not covered for the remainder of the year up until the next insurance campaign. So it's again to facilitate access to care for all staff members. In case you wish to drop insurance coverage, which is still possible, you can request withdrawal from the plan within 31 days of the return from special leave without pay. Of course, failure to withdraw from the within 31 days of the return from special leave without pay will result in you being unable to withdraw until the next annual enrollment campaign. So I hope that the reason why this change was implemented is very clear, and already the same coverage level was required or is already required in the current information circular. So for instance, you were enrolled with your child before the special leave without pay. There's no qualifying event during the special leave without pay. You're returning, you have to be enrolled under the same coverage level, you and your child. So there can be a spouse added without a qualifying event, or there can be other children being added or leaving the plan upon return. Thank you, Leslie.
Julie, the next question is about dental care. And the question is, how is the carryover for dental care applied? And can you please elaborate on coverage details for orthodontic care?
Yeah. So the general cover of dental care equals 80% up to $1,000 per calendar year. Any unspent balance can be carried over to the next year, the next calendar year. In practice, this means that in case there is an unspent balance for dental care, for instance, on the 31st December 2021, this can be carried over and used in 2022. For orthodontic treatment has to start before the patient's 15th birthday, so very important there as well. It's not covered for adults. It needs to start before the patient's 15th birthday. The maximum treatment period is 4 consecutive years. Never reimbursable for adults, again, over the age of 18, unless the treatment is medically necessary as a result of an accident. Orthodontic care is included in the general cover of dental care and hence also limited to that $1,000 annually plus carryover. I hope that was complete.
Yes, thank you, Julie.
Perfect, Julie. And can you tell us what's the best way to reach the health and life insurance section? Yeah, the best way to reach the health and life insurance section, I think we can conclude with that question as well after 1 hour and 20 minutes. So the best way to reach the health and life insurance section is to complete the Contact Us form on the website. Before that was not possible, so everyone would just send an email to hlis@un.org or ashi@un.org. Sorry, that's not true. HLIS, at un.org and ashi@un.org. My apologies, I was getting confused. But now we really encourage you to use the Contact Us form on the website. So you can also, of course, get to know the new website, information it has to offer. And again, with all the requested information, it's easier for our benefits assistants to provide you complete responses and more timely responses. I hope, I'm not sure, Wesley, Valentina, is there anything else you would like to ask me? And if not, I'm just gonna wrap it up now.
Yes, Julie, we don't have any additional questions, at least on my side. Thank you.
Okay. Well,
thank you very much, Julie.
Thank you very much. With that, I'm just going to wish all of you a very nice rest of the day, evening, afternoon. And if there's any additional questions, you know where to find us. Thank you very much. Bye.